right, y'all. Good morning. Happy Wednesday. This is Dr. Traveler with Live to 121. Our goal and purpose is to help people have a desire and want to live a longer, healthier, fuller life. We do that in a lot of different ways, helping them physically, mentally, socially, spiritually. We give different ideas. This is my morning thought. On Wednesday, I usually do something product related, and we have our, again, Live to 121 vibrating foam roller that I'm going to be talking about today with pain. Today we're going to be talking about headaches. I have been doing a melon cleanse this week that I've been talking about. So quick little update. Today is papaya day. Papaya is an interesting fruit, by the way. Very, everyone that's doing it hates papaya, but I actually love it. I think the texture is really weird and gooey, but anyway, it's good. I won't eat it because then that'll interrupt that, but I'm about to finish more papaya. And then there's this lots of lemon and honey water, and anyway, so today is a little more complicated rather than just eating papaya. But okay, so now we're going to be talking about the Live to 121 vibrating foam roller. There are two options. There's been some questions. So we've got the green wave and the black dot. This one, as you can tell, pushes a little. Now there is a little squish. It's got the foam, but this one, the black one, does get a little bit more aggressive. It really depends. If you want to be digging into those muscles, if you've got a lot of trigger points and sore muscles, you might like that one. Any feet problems, neuropathy, the black dot works really well. The green wave, I would say if you are a little more sensitive, then I would use that. I have a green wave in this carrying case right now, okay? Both of them come with the carrying case. It is kind of tough to squeeze it in. If you have any questions, if you live in the area, you can come and pick one up here at the office in St. George, or you can go to live121.com and order those, and we can ship those to you. Okay, so now we're going to go into the headache treatment, okay? This one is actually, I really love this one. It works regular. If ever I have just a little headache, it'll really help calm it down. Now this one's easy. As I do during most of these, I'm not going to have it turned on because then it makes my voice all shake and I'm trying to talk and it just doesn't work. But with the headache one, anytime that you've got it up on the head, I would tell you to not turn it up too high. So there's 4 settings. 1, 2, 3, 4. I don't know if you can see or hear that, but that's a pretty good shake. You can hear my voice, yes. So 4 is a pretty good shake. If you're having it up on the head, I don't recommend the highest setting, probably the lowest setting. Okay, now the simplest one for headaches you can take, you can lay down in bed or on the floor. I actually prefer being in like this with a high chair where I can kind of lean it back. So you're gonna turn it up to like a 1, like I said, and maybe I will turn this up just so you can kind of see. So it's at a 1. I just take it and set it behind, so you can hear my voice shake a little bit. I just set it kind of like you're doing a neck setting, but you can come right up into the suboccipitals and just go back and forth, and I'll just kind of even set it on there and find those trigger points. That's an easy and obvious one, okay? And I don't even give a number. Most of the time I do 2 to 3 sets of 10 or back and forth movement. With this one, it's just to relieve. So if it feels good, lean back, find that trigger point, and just kind of go back and forth or up and down and work into that. And it's really comfortable on your head. It should. Sometimes if there's something maybe hormonal going on, top of the head headaches, if it's not a stress headache, it may aggravate. So just pay attention to that. If it's not a stress or a tension headache, it may not give the relief that you want. And so, but most headaches tend to be stress and tension headaches. If it feels like they're coming from your shoulders or into the neck, this will work very well. Now here's actually my favorite way to treat headaches. And I'll give you one more little tip of advice that we can do too. But put it on the lowest setting again. And what I do is similar if you're dropping it down for like a postural exercise. But if you see that, I put it so that the edge of it is right up against my head. So right into kind of the trigger point area. So I can dig up into there, and then it also shakes between my shoulder blades, which helps relieve some stress. And then what I can do is, as it's on, so I'll turn it on, lowest setting again. See, that feels amazing. You're into the mid back, and then what you can do is hit those. So now you've got the edge, right? So like within the bag, you're up against this edge. And when it's in the bag, it's a lot softer, but you can basically go right up into those suboccipitals, and I can lean my head back into the headache points, and you can kind of hold a trigger point therapy for the headaches. And this, if you get headaches, and especially from tensions, that just feels so nice. You can just dig right into those trigger points with the edge of that, and it feels really nice. And then you can control, like if you feel like you want to dig harder, you can, but be careful not to dig too terribly hard, otherwise you can irritate things. But if you lean it, like I say, up on its edge like that, and have it rest between your shoulder blades, it relieves the muscles between your shoulder blades, and then you can take the edge and work the headache out, okay? That works really well. So there's those two options as far as working headaches. Up high this way, and that's a little more gentle. Go this way and drop it down so that you can put your head right up against the edge and work those headaches. I do not recommend usually like putting it up against the head. You can try that. I just haven't had patients have great success with that, nor have I. It just kind of shakes everything. The other option is, so in acupuncture, headaches tend to come from digestion. One of the strongest, and everyone knows this, you know, you've got this point right here. They say if you have a headache, you find that point in your hand and you push really hard. That is actually LI4, large intestine. That's a large intestine point. And your digestive system does tend to, especially for tension headaches, kind of stem from the digestive system. And so what you can do is turn the vibrating foam roller on high as well. And for some patients, and myself included, I'll go high and set it right into my tummy, okay? And just kind of work that. Your intestines go from right to left high, so you can actually even, you know, work that vibration from right to left, or just hold it onto your stomach. And for some people, especially if you've eaten, that can help calm the headaches down and help with a little bit of digestion as well, okay? So those are the options. Those are the treatments for headaches using the Live to 121 vibrating foam roller. Go to www. I don't know why I said that. Everyone, go to live121.com and order yours. They are 20% off if you type in the code 202020. They're usually $70. That brings them down to $56. So go check it out. You'll love it for those headaches. I am going to eat my papaya and enjoy my day, and I hope you do as well. Have a good one, guys.